Hi, welcome to my channel. This is Nurse Choma, and this channel will focus all about helping you to become the best version of yourself. So whether that's providing for you career advice, business advice, marketing advice, relationship advice, and just really helping you to excel in whatever path you are on right now. And so today specifically, I'm going to be talking all about charting tips for my nurses. So helping you to better chart correctly so that way you can be a safe nurse and that you don't have any issues or make any, significant mistakes. So stay tuned to the very end if you feel like if you want to really know how to chart properly and accurately as a nurse. All right, so let's go ahead and talk about what you can do to chart and to chart, some charting tips that's going to help you. And I am sharing you advice from my own experience as being a nurse. I graduated from nursing school with my BSN from San Diego State University, and after that, I practiced predominantly med-surg tele-nursing. Also done some travel nursing, correctional nursing, etc. So I've been exposed to a lot of different types of charting systems, and then also the best way to really chart from a safe standpoint. So I'm going to give you, in this video, I'm going to give you 9 tips, all right? 9 different tips that's going to help you to chart effectively, safely, and accurately, all right? So the first thing, number one, especially when you're as a new nurse, is that you want to get organized. It's hard to chart correctly and if you're kind of like all over the place, and when you're first starting as a new nurse, there's a lot of information. It's going to feel very overwhelming, to like cover everything and navigate everything, etc. And so you have to get organized. You have to, I remember, and some nurses are different, and every facility is unique. So there may be like a very specific S-bar form that you have to use at your facility that they'll provide. And then you just, write on that and get organized that way. It kind of really honestly depends. And there's also a lot of nurses that honestly bring their own charting, and what we call them is like a report sheet or a brain. That's what we call it in nursing language. And so you use that in order to track, for example, vital signs, like, the vital signs, any abnormal signs, the assessment, the medications that you need to give, the last time you gave it, procedures, and etc. So one of the safest and most important practice I would highly recommend is getting organized. That was the thing that really made a difference when I first started, is that I would come to work and I would use the templates and the S bars that they had there, but it wasn't working for me. Like um, it wasn't working. Like I was still feeling overwhelmed. I was still scattered. And when it came time to actually chart, crickets, like, wait, what should I put here? Wait, what happened again? And you don't want to be just looking at other people's notes and copying and doing all that stuff, because that's wrong, essentially. So you want to get organized and figure out, okay, how can I get more organized so that way it's easier for me to follow through, and that way it's easier for me to chart what was done and what wasn't done, and more like what was done, so that's probably the biggest thing. And so I recommend either creating your own brain, either borrowing some from your coworkers and seeing what they use. Like if there's a template that they use that they prefer, like a different S bar, anything, and just printing multiple copies of that and bringing it to you to work is going to make a profound difference. So that's number one, is that you got to get organized. The second thing, number two, is, and you should definitely have this on your first day, is to get a watch. All right, so go, I don't care where you get the watch. You can go to Target, Amazon, wherever, but go get you a watch. And it should be a watch, not one of those watches where, like, those like old school type of watches when you look at the time, you have to, and it's not like easy to read right away. No, get a watch. Then when you look at the watch, like the numbers are right there and boom, it's easy to track. And then if it has like a timer on it, that's also great too. Don't rely on your cell phone um, at all, because what you don't want to do, what you don't want to do is when you are, excuse me, when you are working and let's say you want to, you're old school, you want to count the respirations or the patient or whatever it looks like that you need to count something and oh, you pull out your phone in order to do that, it looks bad in front of the patient that you are using your phone even though you're using it to count time or something. So have like a watch that you can quickly look at to see what time it is so you can note take that time. And time is very important when it comes to charting. You may not be able to chart something in real time, but if you can recall the time that it was and like take that down, that's really essential. So I would definitely recommend that you get yourself a good watch, one that will you can easily read, quickly read, and that way you'll make it really simple for you to take note of the time when you do certain things. For example, when you give pain medication again, when you check their vitals again, whatever that looks like. All right. So make sure you get a watch, and I'll link below some recommendations on our Amazon that you may find helpful. All right. The third thing, number three, is to get yourself like a little notebook. So it's good that you have your S-bar or your brain or your report sheet. But when you're first starting as a new nurse, there's a lot of stuff that you don't know. And it really depends on whatever your experience was like as far as like the training period, the preceptorship period that you had. And during that time, I recommend that you have like a little notebook because in that notebook, you're going to write out everything. Something as simple as like about this size of the notebook, maybe even smaller actually. And so what I did is that when I was being trained, I would write everything down that they told me. Okay, this is where the Pyxis is. This is what the code, how you put in your code. This is the protocol for Foley catheter. This is where we get the blood. Like all that stuff, I would put it in my little notebook. And usually I wanted to get one that was smaller than this, so that way I could be able to stick it in my pocket and be able to pull it out. And so that will make a huge difference. So you look like you actually know your stuff, and you don't feel intimidated by the environment because you wrote everything down. Granted, there'll be some things that you'll still be exposed to later on, but you'll have a lot more resources in front of you, and it's just going to make your life easier. The notebook is also essential too, because not just as far as the environment, but there may be certain types of fundamentals in nursing or things, medical practices in nursing that you forgot about that you'll be re-exposed to, and that you need to be able to chart specifically. Like for example, if you have a patient that has like heart failure, and if you write it in your little notebook, you can write down what are the typical signs and symptoms with heart failure. Or if you had a patient that had some type of procedure, what are the typical precautions and outcomes and that type of stuff. That's important. Having all that data in that notebook is important because it's going to help guide you as far as like how you're charting your notes. And I'm going to give you an example in a minute as well. So having like a reference book, because or reference notes as far as different common diseases. When I was first starting, there was a lot of diseases that I still had to memorize and remember and recall, and I was exposed to them. But having a place where I could easily see, wait a second, what are the normal medications with hypothyroidism? What's the normal signs and symptoms with hyperthyroidism? Like having that information at my fingertips that I can easily pull out was really important. And I don't want to, have like a big clunky book, that I would carry in my, like there's just so much to put in your pockets already. And so that's one thing that's important is you having like a little notebook that you can put in your pocket so that way you can use it as a reference point when it comes to appropriate outcomes for the patient. Okay, so now let me show you what I mean by this in this next example. So number 4, the fourth thing when it comes to charting tips is using specific signs and symptoms for that diagnosis. Use specific signs and symptoms. So I remember when I was first starting, um, I I didn't realize it, but I was charting very general information. And general information does not hold you up in a court of law, okay? It does not hold you up if the patient falls later and they go back and see your charting. You need to have very specific information, okay? So here, let me give you an example of what that looks like, all right? So let me show you an example. So a good example, so let's say, for example, you have a patient that has pneumonia, okay? So you may chart, this is what you may chart, and your patient's doing okay, but they're in the hospital because they have pneumonia. That's what their complaint is. That's what their diagnosis is. And so let's say you go into the room and you see them and you see they're doing fine, right? You're doing your hourly rounds. So you may chart something like patient resting comfortably, no signs of distress, right? That's something that you may chart. Patient resting comfortably, no signs of distress, right? So, and that's okay, right? So like you're putting that in your medical notes and everything. That's okay, but here's something that would be more specific to the diagnosis that they have and why they're there. So instead of charting that, chart something like this. Patient seen with non-labored breaths, right? Because their issue that they're there is a respiratory issue with non-labored breaths, no signs of respiratory distress. So not just distress, because there's different types of distress. There's cardiac distress. There's also, you can also be in distress because there's something going on with your stomach, so like being specific, no signs of respiratory distress. Skin is pink and warm to the touch, right? Because sometimes if a patient, depending on how old they are and other conditions they have, they may be cold, they may, because they have an infection. So saying that the skin is pink implies that they have good circulation, and especially also in addition to warm to the touch, right? Not like you touch them and they're hot, right? Because if they're hot, they have a fever, right? So when you put very specific signs and symptoms, and like I said, this is if this is the scenario, right? So you're not charting false data, like meaning that they're not in distress and you're putting that they're having no distress, right? But I'm just showing you an example of how to chart more specifically. Okay, so that's the example right there as far as like the specific diagnosis. Another thing as well is charting specific outcomes for the procedure, right? So the more specific you can be, the better, right? The more specific you can be, the better, because it really makes a big difference. So here's an example, right? Let's say you have a patient that just got back from surgery, right? So you work in the day shift or maybe night shift. Rarely happens on night shift, but let's say the patient comes back from surgery. So you may write something like this: patient arrived after surgery, vital signs taken, no signs of distress, right? And all that really did happen. They came back from surgery, you took their vitals, it was normal, and there was no signs of distress, and now they're fine, right? That's a common thing that you can see happen, right? So patient arrived after surgery, vital signs taken, no signs of distress. That's okay, but that's still too general. So let me give you an example of how to chart more specifically, okay? So this would be a better example here. Patient arrived after surgery at 12:01 p.m. Okay, so I'm putting the specific time. In fact, I could have even put seen patient upon arrival post-op at 12:01 p.m. That would have been even better. Dressing, because if they had surgery, they most likely had an incision, something was opened up, right? So you have to note take that. Dressing is clear, dry, and intact. Okay, and I put in the vitals. Although there's usually a section where the CNA will chart the vitals or something, but you should acknowledge that you saw the vitals if they just got back from surgery, because that's the time that's most critical, right? For that way they don't have like hypotension. So blood pressure is, and state the actual vitals, not, the vitals was normal or I took the vitals. No. So state the vitals. Blood pressure is 119/76, whatever it was. Heart rate is blah, blah, blah. And then here's another part, tolerated procedure well. Adding that part is important too, because because they could come back from surgery and they're horrible. They're in a lot of distress. They're very uncomfortable. They're throwing up a lot. They have a headache. Like all these things are going on. But if you put down tolerated procedure well, you're acknowledging and you're letting somebody that would read this, if somebody read it later, that they did tolerate the procedure well. They based on your overall assessment of them, versus they're doing okay, or versus resting comfortable. See that? So using this specific type of language really makes a difference with charting more effectively and accurately. All right. I hope you're finding this helpful so far from what I've been sharing. The sixth thing you want to do is be as objective as possible. Okay. Be as objective as possible. So try not to um, try to be more objective. So subjective would be you saying, oh, patient is being rude, patient is being dismissive, patient is um, yeah, like those would be some examples, and that's more so from your point of view. But objective would be more like patient stated you are bad. Patient stated, right? So saying what they said, not inferring what happened. That would be better charting, because you're not inferring your opinion. You're not inferring what you think they said, or how it was said, right? So you have to remove your subjective data from that. The only honestly true subjective data that should be in your charting predominantly is what the patient said, right? Patient says, I feel blah, right? Patient says, I feel nauseous. Like that's really the only subjective data you should be putting in your charting. So try to be as objective as possible when it comes to your charting. The seventh thing is this is really hard when it's a busy floor, but do your best to try and chart in real time or as close as possible, or try to take note of the time that it happened. Okay? Try to take note of the time. That's why you need that watch. You can chart that down. So certain things need to be charted as closely in real time. Like, for example, the medications that you gave, especially if it's like all medications, especially narcotics, like the time that you went back and reevaluated their pain after giving it, like all that. If they went into a code, that time is so important, so you have to take note of the time that it happened, so that way you can chart more accurately. That's why having a good watch is important, so that way you can chart correctly. And then number 8, this 8th thing is never chart incidents. So if any type of incident does happen, whether an incident is like some type of med error, mistakes, falls, you never actually chart that in there. So you have to do what you call an incident report if that does happen. And don't feel bad, it happens. It happens. A lot of nurses will not admit it to you. They won't tell you, oh, I've been here for 10 years. I made multiple med errors. They're not going to tell you that. They're going to let you think that they're a perfect nurse, okay? And even though they've been there forever. Don't worry. Just do your incident report and keep on pushing, all right? You didn't kill anybody. If the patient is fine, you are doing a good job. You're doing your best, okay? But never chart incidents. Even if there's something did happen, you still have to say it objectively, though. And you can always go to your charge nurse. Hopefully you have a cooperative night charge nurse to give you advice as far as what to chart or how to chart it. but be very objective. Don't chart incidents, as well. Okay. And then the ninth thing, number 9, is try to use some level of storytelling in your charting. So think about when you watch a movie or you watch a film or you read a book, there's a level of storytelling, meaning that they describe the scenario to you. It was a warm summery night, right? It was a warm summery night. The atmosphere was humid. It was around 10 o'clock, blah, blah, blah. I walked to the doorstep, and so because of that, that's why the book sounds so good and people want to read it. So you're not necessarily applying the exact same framework of wording, but the point I'm making is that you need to make the words kind of come alive in your charting, especially to avoid misinterpretation, especially if you have a patient that is known for, there's certain patients that are known for like having poor misconduct, certain patients that are known for like, and when I say certain patients, I mean some patients, not all patients are wonderful, but there are some patients that honestly are malicious sometimes, and so if you have to be conscious of how you word things. So if I was trying to be really careful with my wording, with my charting, and I was trying to imply like storytelling, I would probably be putting something like enter into the patient's room, patient seen standing over, enter the patient's room, and patient seen standing over their bed, with a disgruntled look on their face, or patient complaining. Enter to the patient's room. Patient seen standing upon the bed, restraints on the floor. Patient yelling, "Get out of here!" Patient stating that I do not want you as my nurse. Entered and seen patient's IV hanging out, right? That sounds like a story, right? That sounds like a story, like, oh, okay, versus you writing down like patient yelled and didn't want me as a nurse at the end, right? So do a level of storytelling as well, because it will make a difference when it comes to the charting. Because then now, like, let's say, even if it's not something that goes to court or whatever, but if, for example, the charge nurse or your manager, if something happens and they want to later on go look at the notes and see what happened, they can gather very correctly what exactly happened. Okay, yeah, okay, that it was the patient's fault, or the patient did do that, or she did do her best, or whatever, because of the way that you charted. There's like a saying that goes, if it's not charted, it never happened. And so you have to see your charting in that way as well. Okay, so use a level of storytelling in order to recreate the experience for the reader, and that will really, really help you a lot when it comes to your charting. These are my 9 charting tips for nurses. I hope that you found this very helpful and informative. I hope that you learned something from it. If you did, go ahead and let me know in the comments. Let me know exactly which tip you found the most beneficial or helpful. And let me know as well, like, what are some other practices that you've experienced when it comes to charting? Like, what are some other things that you noticed helps you? If I didn't mention it, I would love to hear what you suggest. And then also another thing too is that, remember I mentioned about getting organized? I put together something that I put together. I'm gonna show it to you guys right here. And this is my own brain report sheet that I put together for you guys. And essentially, it's a simple way for you to track. So this will be for one patient, okay? It's going to be for one patient. You track your notes down here. And so essentially what that's going to do is going to help you to be organized. I created myself, I kept it in mind. And so one thing I recommend too, when you're using this type of sheet as well, that you're going to go ahead, like, for example, let's say they tell you patient has a wound on their arm, you would circle it in the photo, for example, Or if they say, patient is complaining of stomach pain, you circle the stomach area, right? So these are different things that will help you. So if you want to get that, it's available on my Etsy store. You can click below to get that below. And then also I do have a book that I also recommend too that I've written. It's called How to Become a Registered Nurse, Successful Principles and Insights for Today. The inside of my book, it doesn't go over charting tips specifically like I went over today, but it does go over other things for nurses, such as interview tips and how to survive nursing, and most of the book is really geared towards helping you to become an RN. So if that's your ultimate goal, or you're RN right now and you just need some practical advice, this will be a great book for you to get. You can get this book on Amazon. It's located on Amazon and it'll be shipped directly to your house. All right. So once again, let me know. Like, subscribe, comment below. Let me know your thoughts. Get the book, the templates, and I would love to see you in the next video. Thank you for watching.